In terms of the collective ambition, we've been very lucky, I think, and that's probably one of the reasons why we were fortunate in gaining devolution in the first instance, because it already has a history of ambition and cooperation. 37 organisations working very closely together to enable change to take place, to transform the services within Greater Manchester. It sits at the heart of the Northern Powerhouse, a phrase which is often used these days. We have a number of skilled, healthy and independent individuals who are very crucial to bringing jobs and investment to the city and to Greater Manchester in its widest sense. I think it's important that it's not just about health and social care, but it's, as I say, it's about across that wide range of public services, so people can start to work well, live well and age well. It is important that we see the whole of the journey from cradle to grave. It is important to see that if we can enable individuals to take care of themselves in a different way, it will certainly reduce access to A&E services, for example. It can certainly mean that individuals can start to work in a different way with members of the public, with citizens, with residents, in order to enable them to live a more satisfying life going forward in the future. I thought it was useful to give you a little bit of background around the devolution agenda. So we started off in November 2014. Devolution covers the areas such as transport, planning and houses, and a new elected mayor. We have an interim mayor at the moment. There's an ambition for 22 billion to be handed to GM, and again that gives you a significant amount of accountability and responsibility, because suddenly it's us that has the responsibility to manage that money. And through memorandum of understandings with CQC, Monitor, Public Health, and also in the next few weeks we're hoping to sign off a memorandum of understanding with Health Education England. All those things suddenly start to say we actually have accountability and responsibility for how we deliver that ambition within Manchester. We are the accountable officers. The buck stops with us in that sense. So 10 GM councils, 12 commissioning CCGs, 15 NHS Foundation trusts. We have a workforce in terms of health and social care of around about 100,000 staff, and that's the paid element. The unpaid element, the volunteers, the carers, etc., is probably comparably as large, so a significant workforce that we need to address as we move forward with the agenda. 37 local authorities, NHS organisations working together. We've talked through, in terms of the earlier presentations, around what does that mean for you as an individual organisation, and there's a very strong principle in GM now where we say individual sovereignty, it just doesn't apply. This is about developing the system for the future. It's about how we agree to work together in order to deliver the GM ambition. Of course, when you actually get down into the nitty-gritty of that, sometimes that can be quite difficult for organisations, because it does challenge them in terms of what they have to give up in order to develop their future arrangements. So as of April, we should receive 6 billion, quite a significant amount of money, to start developing the transformation agenda. On the top of that, we've been very fortunate to gain a further 450 million for transformation monies to assist the process. This isn't about bailing out those who are in deficit. This is about ensuring that there is a process whereby individual organisations now can bid against that money, but it's got to be very clearly aligned to the strategic plan and their locality plans, which I'll touch on in a few moments. A bit of a detailed slide, and there's nothing in here which is unusual to you, so a lot of it is around what you've already heard this morning in terms of the initial presentation. So the main goal, just to highlight bullet point 3, is around the fastest and biggest improvement to health well-being of the 2.8 million residents and population of Greater Manchester. Nothing in there which is what you wouldn't expect to see. So in terms of why we're doing this, just useful just to see, because it helps to focus the mind, I think, in terms of where we are. So we know that more than 2/3 of the premature deaths are caused by behaviours which could be changed, and that's quite a powerful message in terms of if we can intervene earlier through an improved prevention arrangement, that might well help to prevent premature early deaths. More than 1/5 of the 50 to 64 age group are out of work, a significant issue within GM. How do we then start to work differently to both promote opportunities for different types of employment, but also how do we encourage the longer term unemployed back into work? Partly that's maybe to do with ill health, but by addressing some of those health problems and improving overall health and well-being, we might then be able to reduce the level of the long-term unemployed in the Greater Manchester area. Just picking up on a couple of other points, we spend more than £1 billion on long-term conditions linked to poor mental health and life expectancy. And any day there are 2,500 people in a bed which could actually be treated better in the community. They're all powerful statistics in terms of giving us the rationale for why are we doing this. The slide here just shows you in terms of the shadow governance arrangements which are in place. And again, some of you already have some of these things in place, but what this shows you is that it's that spirit of collaboration, commitment towards a joined up strategic approach to how we deliver the health and social care agenda within Greater Manchester. So it is a bit difficult, I think, to see on the slide itself, but it just tells you the various partners which are involved in this. And having attended the Strategic Partnership Board, which is the main engine room, effectively the 37 organisations working together, there is a very strong principle, particularly from chief executives, who are saying, I appreciate that in making this decision, it means that that might impact adversely on my organisation, but we're comfortable with that because we know as a system we're all signed up to delivering the overarching ambition. That's quite a very different place to be compared to what I've seen in some other places when I've been out to do some of these similar talks. And so I think it is a powerful position. I think the difficulty is, and the challenge will come when we get down to the nitty-gritty of what does a single hospital provider look like in Manchester when it then starts to impact on other parts of their individual organisations. So in terms of our efforts over the first year, I mentioned we'd already earlier that we'd talked about developing memorandums of understandings with a variety of organisations, and that was to help us to break down some of those regulatory boundaries which often prevent us and hinder us delivering what we need to deliver. And from a personal perspective, the work that I've done with Health Education England to develop the Memorandum of Understanding has been really informative, really insightful, a great willingness to work with us in order to look at how do we deliver the ask for the GM workforce? What is it that we need to do? And how do we take responsibility for the funding allocations through HE in order to deliver what we need to do in the future? There's a question, I think, from the room earlier around how do we start to educate our future workforce. And we've already started conversations with the 3 universities in Greater Manchester to look at changing the undergraduate programmes, to look at those values, behaviours, those core competencies that we need all the workforce to have, so that when they come out at the other end, they actually come prepared and fit for purpose. But at the same time, asking the question of the universities, well, given the pace of change, given the speed with which we need to do this, how can you start to adapt the workforce of the future who are currently in your institutions to actually operate differently? So that conversation is taking place with the universities, and we're hoping to secure a bid of around about 150k to then start working with the university to develop a different type of undergraduate programme. Devolution has allowed us to do that. Out of the 450 million transformation monies that we've got, 10 million allocated for organisational development in the workforce, and that needs to be very, very specific in terms of the transformation agenda and what that might look like. So in terms of the strategic plan, we've worked with colleagues across Greater Manchester. The 10 localities have been asked to produce their locality plans, which articulates the strategic vision around integrated care, around Healthier Together, which is a bigger programme of change in hospital services, around emergency care, surgery across Greater Manchester, and also in improving primary care. So at local level, the respective organisations are now required to work towards their locality plan in conjunction with their colleagues in that particular patch, but it must be aligned to the strategic overarching plan. So the document's on the website for those who are interested to go and have a look at it. It sort of articulates the ambition, how we've got to where we've got to, what we hope to do next. It is an interesting read, but it's very similar, I think, to a lot of what you're already doing anyway. So in terms of focusing the efforts, there are 5 building blocks outlined on there. radical upgrade in population health prevention, transforming care in localities, standardising acute hospital care, standardising clinical support and back office functions, and enabling better care. Those are the main principles at which we work. That sort of underlines the work streams as we move forward into an implementation phase. The 10 locality plans, as I mentioned, they all have a number of key workforce aims, which I've highlighted there. So I'm now starting to talk with the localities about what that might look like in terms of what they need to do at local level. Challenges for the workforce. Again, there's nothing new in any of this. And I think one of the things I'd just like to pick out is about the lack of capacity to drive the agenda forward. What I find when I have conversations out with the respective 10 organisations is that, but Yvonne, I've got these things to do over here. I've got operational issues which are testing me and taxing and taking up all of my time. And I'm saying, actually, this is now your day job, and you need to move from looking within to looking without, to looking at how you can work in an integrated way across your locality in order to make those changes, which will actually make some of those operational issues less difficult. I know that's a big ask for some people, but the system itself needs to develop the capacity in order to give time to this. So, top key message. I won't go back to the other one in terms of time. So, top key messages. Engagement and partnership working are key to success. We've started a dialogue with our trade union colleagues, the Social Partnership Forum, to start looking at how do we engage with staff, how do we engage with trade union organisations across health and social care. And again, that is a very different environment to be in for those of you who's worked in health forever, to suddenly have to engage with public sector trade union organisations is a very different form of language that we use. Indeed, even in terms of having a conversation with local authority counterparts, the language is different in terms of what we need to ask and how we get to where we need to be. Key messages around that ability to interface with the wider public service reform agenda. You know, I'm having conversations now with the fire service around how we use them in terms of first point of care, about falls assessment. What does that then mean for the greater healthcare workforce? How does that feel? What terms and conditions do we employ them on? I'll come back to that in a second. So what I wanted to share with you in terms of the last slide was mainly in terms of the strategic workforce governance arrangements, because I think it's important that we have some form of governance arrangement to help us to deliver the ask. We have the 10 locality plans, we have the strategic plan. The workforce component of that isn't very well developed as yet, and we need to tease that out. Some are better developed than others, some are quite light in terms of content and in terms of what it means, and that's again because they're focusing on their own organisation as opposed to the system within which they work. All this shows you is that the transformation initiatives across the bottom, the 5 key work streams. In the centre is the strategic plan and the localities, reporting into a locality workforce transformation group. That comprises HR and trade union representatives plus operational managers in that locality who are then accountable for delivering the HR workforce element of that plan. So they have to work together and produce their own workforce strategy for that locality. That then feeds into the Strategic Workforce Committee in terms of progress against the plan from an implementation point of view. On the right-hand side is the enabling work streams. Two really to pull out from there is the Strategic Workforce and Education Steering Group. Those of you who are familiar with the LWEGs, the Local Workforce Engagement Groups, is that what they're called? Can't remember. Anyway, the LWEGs as we call them, which is part of the Let Be processes. We've now refreshed that, so now it's become more about how do we deliver the devolution ambition through that with health and social care partners. So we are now sat at the table looking at education and training issues from a health and social care perspective and taking responsibility for the money allocated through Health Education England. That's really different to what I think most people have got currently, and we see that as a very key enabler to working forward in the future.
Yvonne, that's great. Would you like to wrap up?
I will.
Briefly?
I'll just do the last one, which is the pay and reward mechanisms.
Okay.
I think it is important that we have that challenging conversation around how do we pay the workforce of the future when we have the workforce coming from the different components of both health and social care or from other public services. We have to have that grown-up conversation which says which terms and conditions do we employ them on? How do we make those decisions? And actually, do we need to look at something which is bespoke to the area of Greater Manchester? So let's get rid of agenda for change, let's get rid of the public service arrangements and have something which is new and bespoke to reward and satisfy staff working in GM. That's a big ask and that's a longer term ambition, but I think it has to be on the table in order to move some of that forward. I'll finish there.
Thank you very much, Yvonne.